Hey everyone, this is Dr. Jad, and today we're going over the MRCP PACES respiratory station. Watch this video till the end to get all the tips that allowed me to pass with just 11 days practice. We're going to be taking the tips from the first video in the series and applying them to the respiratory station. Before we continue, a quick disclaimer. I don't recommend leaving your exam preparation for the last 2 weeks. I just wasn't given a choice as I'd been put on the waiting list and I didn't think I would be given a slot. Now that's out of the way, here are my top tips. 1. Identify the most common stations. Once you identify the most common stations, you can prioritize your studying. Let's take a look here. 10 conditions account for around 90% of respiratory cases. These conditions are interstitial lung disease, lobectomy, bronchiectasis, COPD, pleural effusion, pneumonectomy, kyphoscoliosis, asthma, rheumatoid lung, and lung transplant. So if you learn these 10 conditions inside out, you're really stacking the odds in your favor. Of course, you want to study as many conditions as you can, but it's great to be able to maximize your chance of success like this. Now that you know what to study, you also need to know how to study. This brings us on to number 2. Structure your studying. If you have a clear system, it will be much easier for you to recall crucial information during the exam, especially as you're going to be nervous. The structure I used was signs of disease, signs of severity, signs of etiology. This specific order lets you examine and present your cases in autopilot, as well as answer questions from the examiner effectively. So let's take interstitial lung disease as an example. The signs are finger clubbing and bilateral fine crepitations on auscultation. Signs of severity include ambulatory oxygen and signs of cor pulmonale, such as raised JVP and peripheral edema. And the signs of etiology may include hand joint inflammation, indicating rheumatoid arthritis, sclerodactyly, indicating systemic sclerosis, and a butterfly rash of the face, indicating SLE. Using this system will make remembering this information and getting into the right mindset so much easier. 3. The importance of a confident presentation. Remember, the examiner wants to know that you're competent, experienced, and a good communicator. I'll give you an example of how to present a case, using interstitial lung disease as an example again. I examined the 60-year-old female who had finger clubbing on inspection and bilateral fine crepitations on auscultation of the lung fields. This is consistent with a diagnosis of interstitial lung disease. She also had bilateral pitting edema up to the mid-shins, suggesting possible cor pulmonale as a complication. In addition, she had a butterfly rash of the face, suggesting an underlying etiology of SLE. This is a concise, well-structured presentation that paints a very clear clinical picture to the examiner, and this is what you will be expected to do on the day. There's no one way to do it, and the more studying and practice you do, the more comfortable you'll become with your personal style. 4. Impress the examiner with knowledge beyond the curriculum. This will set you apart from the other candidates, although it's important to remember that you're not in direct competition with anybody. Just remember a couple of fun facts per condition and you'll be fine. With interstitial lung disease, you could mention that pirfenidone and nintedanib are antifibrotic drugs, and that NSIP is more likely to respond to steroids and immunosuppression than UIP. It's a simple trick that will get you extra marks. 5. Anticipate the examiner's questions. Your examiner will ask you to present your findings, discuss initial investigations and treatment, so you already know what sort of questions to prepare for. But you can also give leading answers to fill up the questioning time with topics you know about. For example, with interstitial lung disease, if appropriate, you can mention that you would consider treating it with antifibrotic agents. Your examiner will then likely ask you to name a few, for which you can score top marks. Of course, it's always important to remember that the examiner will probably have some questions that they're going to want to ask you regardless, so this isn't a completely foolproof system. 6. See signs. As important as practicing with hospital patients is, it's just not that efficient. We've all spent hours trying to see 1 or 2 patients. You will never get the exposure to all the signs and pathology this way. By picking the right online revision resources, you can make your revision much more efficient. The 2 online resources I used were PASS and Clinical Skills Pro. I personally think it's a good idea to use them both, because the mixture of pathologies, presenting and questioning styles will make you dynamic enough to think on the spot and ace your exam. By not relying on one resource only, it makes you much better at thinking on the spot under exam pressure. I don't think I would have passed without using both PASS and Clinical Skills Pro, so I would recommend them both. Even though it costs more to use both, you can use my discount codes in the description below to save money, and it's much cheaper than repeating the PACES exam, so I think it's a worthy investment. Now you know the secrets to acing your respiratory station. I hope this was useful. Please like and subscribe so you don't miss out on any tips on how to pass your PACES. Feel free to ask any questions in the comments section, and see you in the next video.